And we're back and we're moving into our second conversation for today. As we've mentioned earlier, there is a focus on looking at birth registration in Belize. It is a collaborative project and we're going to get the details from those who are involved this morning. Joining us via Zoom, we have Khandi, who is the first class clerk at the Vital Statistics Unit. We have Kerrie Williams, who's the Senior Protection Assistant at UNHCR. We have Dr. Dionne Chamberlain, who's the lead consultant from Chamberlain Consulting, and Luwani Cayetano, Child Protection Officer from UNICEF. Good morning, ladies.
Good morning.
And thank you all for letting us know what you have been up to. I want to start off with what is just the obvious question in terms of why is it a concern, birth registration in Belize? How are we doing?
Kerrie, I guess you should be the one that talks about this.
For UNHCR, we decided to be a part, we were actually invited to be a part of the overall birth registration project, which is a project that started in 2019 and should complete in 2022. UNHCR decided to take on one of these important objectives in reviewing the birth registration project because of its importance to the Belizean public as well as to our organization on a global scale. We decided to be a part of it because we know that UNHCR is normally associated with protecting asylum seekers and recognized refugees in Belize, but we also have a focus on persons who are stateless. And the persons who are stateless are often those persons who are nameless and faceless because their birth is not registered or they're unable to prove from which country or territory they were born. And we are committed as an international organization to support the government of the country in which we operate to improve its processes when it comes to nationality laws and providing nationality documents. And so we participated in the steering committee and took on this great task of, along with Chamberlain, our wonderful consultant, the communication strategy to start off this process on a good foot.
Yeah. Now,
just to give you a little bit of background on that, Marlene, there was a bottleneck analysis done by the stakeholders, and the stakeholders at the time were the Belize Vital Statistics Office. It had a part of it UNICEF, and of course, the Belize Vital Statistics Office, Ministry of Health and UNICEF played a very large role, and of course, the Mexican Embassy. And what it showed was that 96% of the persons in Belize have been registered. And I know that a lot of us may say, well, 4% isn't a lot, but 4% of our Belizeans not being registered is of dire interest, because when a child is not registered, it means that they're invisible to the environment, and invisibility poses a lot of threats, a lot of risks, and also denies them a lot of their human rights. And this bottleneck analysis, when we actually delved down a little bit further into it, it showed that the persons who were not registering their children were those from rural communities, mostly in the west, in the north, and definitely the south of Belize. And the persons affected were indigenous persons, asylum seekers who had children in Belize, and of course the immigrant population. Now, a child who is not registered, when I mentioned being invisible, if they are a victim of child trafficking or many other ills of society, if they're not counted, then they're invisible. And so having them be counted gives them great benefits. And the benefits are to health, to education, and other human rights that a human being and a child gets. However, we've realized that it's not only children that aren't registered. We have met up in our surveys and our results that older people up until 18, 20 years old are not registered. And so the purpose of this entire campaign is for us to realize the seriousness of doing it, but getting the Belize Vital Statistics Office which is a part of the Solgen and the Attorney General's office, to come on board and assist in driving this, because it is so important to our children to have a face, to have a name, and to be seen as a citizen of this country.
Now, the issue of birth registration has been one that has been a concern for quite a long time. When you talk about indigenous populations, for example, it was usually really difficult or a long process or expensive for them to get to a vital stats office, if that's the case, and get the registration done. So, Luwani, do you want to chime in on some of the efforts that have been made to get us to the 96%, and then what plans will be made to capture that final 4?
Yeah, I think one of the really great things is that there has been a lot of efforts in Belize to get children registered. Yeah. And I think in partnership with the Vital Statistics Office, UNICEF and UNHCR and other key stakeholders, Social Security, Ministry of Health, have really sat at the table for a long time to do this. Several years ago, we did a mobile registration campaign and going across the country to support families and support children to get registered. And then, as Ms. Dionne mentioned, there was also a bottleneck analysis, because at that point we realized families were saying that children had been registered, but we still had a percentage that we weren't reaching although there were great efforts, right? So the analysis really dug deeply into the fact that there's a lack of access, or people don't have all the information that they need to be able to take it to the next step. And so what we've done in the past 2 years is as a result of that bottleneck analysis that was commissioned by Vital Statistics, which I think it's really important to say, this is efforts driven by the national partners. UNHCR and UNICEF are supporting this process, right? So once they dug deeply into the bottleneck analysis, they realized that they wanted to make an action plan linked to the recommendations coming out of that analysis. Yeah. And one of the key recommendations was we need to let people know, we need a communication strategy. We need to let people know and understand what is the process, how do you do it, and why it's so important, right? Yep. So, for us as UNICEF, our interest is making sure that children have access to services. Once you're registered, and then once you take the next step to get the certificate, you of course have access to services like healthcare, education. Yeah. And then also it protects children from risks of human trafficking, in Belize, child marriage or early unions. And so for us, that's, we always want to see and support efforts around this. But I think in addition to some of the policy efforts, and changing legislation, and, bringing stakeholders together to create a seamless process, I think it's really important to make sure that the public that access the service understand the messages around registration, but also understand how to access the service. And I think that's why for us, it's really exciting to support this effort right now, because it's really about, engaging the public, letting them understand, and then bringing in some cases, in some villages, we'll be bringing services directly to them. Yeah. And I think that's really exciting.
So, Khandi, why don't you demystify the process for us? What is the process of registration, and how is it different for rural areas versus urban areas?
The process of registration is quite easy. I can say that after a child has been born, the parent of the child, if both parents are available, they can take both of them take their proof of birth to our registration clerk, along with a valid ID. If the couple are married, then they need to take a copy of their marriage certificate and start the process of registration. It differs as to which district someone should register their child. Yeah. If a child is born in Belize City, any of our hospital or at home, they would then if even not Belize City, but in the district of Belize, because we have Ladyville, Hattieville, Mascal, and places like that, then their register will be at Carhushina Memorial Hospital, where one of our registration clerk is stationed. And likewise, we have other clerks in the different districts. So district birth can be registered at that particular district.
Yeah. It's a centralized office, right?
Yes, ma'am.
Yeah. So I know that that's a part of the barrier. I heard you allude to earlier about taking the services to them. What's in store for that?
As a part of the communication strategy, our intention is to, our initial intention was to have a full launch and to do a media tour with support from our consultant. But with the changes that has taken place due to COVID, we have had to go back to the drawing board. And we are in close collaboration, again, with our sister agency, UNICEF, and with BBS. We plan on going into the communities to aid these communities that often have difficulty in going all the way to Belize City to register a birth. We often think for us, for myself, located in Belmopan, it's a short trip or it's an inexpensive trip.
Yeah.
But for someone that is living in these remote communities in the South, it is a day's wage or not days wage, but weeks of their wages to be able just to go to Belize City to register a birth and therefore further apply for a birth certificate. We take it lightly, but for these communities, it is an essential service, and we hope to, by going into these communities, alleviate some of those concerns and some of those issues in terms of expense.
Yeah.
We also hope to provide other services, but we have our communication launch tomorrow, and I hope that everybody stays tuned and hears what all we have planned.
But Kerrie, before we move on from that, you know, when I hear the process that's outlined, one of the biggest concerns would be for the population. I know that UNHCR works very closely with you, talking about asylum seekers and refugees. You know, some of this documentation they may not have, or if someone has entered the country illegally and has had a child, they probably don't want to go to a government department to declare that they're here, although their attempt is maybe to seek asylum eventually or find refuge here. How do you overcome these barriers?
For our asylum seekers, once they are a registered asylum seeker, they have certain rights. Obviously, they don't have to be afraid of being returned to their country of origin because they are protected by the law and in collaboration with UNHCR and our Refugees Department, which is under the Ministry of Immigration. But it is a barrier that sometimes our asylum seekers are coming from their countries of origin where they're in fear of their lives, and it's difficult for them to approach a government office. We do hope that through this communication strategy, we can, in differing languages, because we know that language is often a huge barrier for our asylum seekers who are often from our northern Central American countries. They speak primarily Spanish. We hope that this communication strategy, we're launching it in several languages, Spanish, Mopan, and Quechua Maya, that we can alleviate some of those fears.
Yeah.
That as long as they have that asylum slip for our asylum seekers, that your child is born in Belize, that child has all rights bestowed upon a Belizean. And that by seeing UNHCR as a part of this initiative, they understand that we are here to protect their rights and that we're here to work in conjunction with them to ensure that their child and their child has those rights. And so it is our overall objective, as I previously stated, and just echoing it again, not just asylum seekers, but Belizeans as well, and supporting primarily BPS.
Yeah. And it really is important to be able to drive home the point of what happens when a child isn't registered. What are they being left out of? Because we take it for granted. 96% of people just do it because it may be that it's easier, maybe we've allotted the time, maybe we don't have the particular barriers in place, as you very clearly articulated there, Kerrie. But what happens when a child grows up in this country and has never been registered?
These children, unfortunately, add to the 10 million persons worldwide that are considered or are stateless. These children become invisible. It is difficult for these children to receive what is their right: health, the right to an education. We know that between the ages of 5 to 14, a child must be in school. And if these children are not registered, how are we able to track them to ensure that they're receiving a proper education? How are we able to identify through or make appropriate policies that benefit all children or the majority of children when we can't take into consideration their specific needs, being the children of asylum seekers, which is a unique category, which brings forth unique challenges for them. And if they aren't counted, and Belizean children of Belizean parents as well, they fall into another category of those who would be without the services that they need, that we all need. And so for us, we've taken on this wonderful task with Chamberlain and our other partners that Luwani had previously mentioned. And we hope that not only children, because we do know that there are some adults in that 4% not registered, who are not receiving the services that they deserve.
So you're right.
And I think on top of that, I think in addition to that, Marlene, you know, what's important too is we are faced with a pandemic, right? And so globally, we also know that families that may have not had access before, it is even more difficult now, given, you know, lockdown measures that are needed for our public health. And so globally, UNICEF and UNHCR have really been saying, you know, we understand that measures have to be put in place to make sure that people are safe, but children are still born. And so once lockdown measures have been slightly restricted and governments are putting in place social distancing, then there's certain guidance that we've put out globally and that we're kind of adhering to here in Belize that I know Dionne will talk about in terms of the launch tomorrow and all of that exciting stuff. But I think it's really important to say that globally there's an understanding that on top of everything else that kind of hinders children's access, we know that a pandemic exacerbates that. But we also know that there are things that can be done. So we can continue to advocate for an online registration system. You know, that is not going to happen today or tomorrow, but we can continue to advocate for something like that to take place in our country. We also know that we can advocate for mobile registration. You know, where lockdown restrictions have been lifted, where communities are responding and respecting social distancing, we can go into communities and provide registration service. We can also ensure that bedside registration is happening, where families are having children in hospitals during this time. Registration clerks can go to the bedside and register children to make sure that when a family leaves, they leave with that document, with the registration document, the proof of registration documents, right? We also know that we have to make sure that registration clerks are protected, that they have on the protective gear that they might need. And so those are things that we're advocating for globally and nationally to make sure that, you know, we understand that they're already in normal times, in quotes, right? In normal times, there's already that difficulty, but during a pandemic, it's even more so. And so that doesn't mean that we should stop the service. It just means that we have to find other ways of ensuring that people still receive the service that they need. Because when children don't have this registration, as we've all been saying, you know, I think that's the key message here today, there's so many risks, and we really want to make sure that we mitigate those risks.
Absolutely. You know, and I think, Khandi, if you could just tell us a bit about that, about what's been the new norm for the Vital Stats unit. I hear what Luwani is saying, you know, when everyone is choosing very carefully what activities they want to engage in, people may say, well, I don't want to go in a line at Vital Stats because that may not be safe for me at this time, or just not an activity I want to do. So talk to me about what the new norm has been for you at Vital Stats, and then we'll move the discussion forward.
Okay, so currently at our central office, the norm is, of course, social distancing. We must wear masks. before coming, have on a mask prior to coming in. And seating arrangement has been placed so each person's are 3 feet apart.
Yeah.
In regards to the registration clerks, we have provided them with their PPEs, and so it's somewhat the same prior to the pandemic, just that they are able to see less people in the office.
Yeah. And then what about turnaround time for getting, because there's a process of registering and then there's the collection of the birth certificate itself. Do people typically follow the process all the way through to receiving their birth certificate?
Yes, people do follow the process.
Okay.
Because
it's very important to state though that what we're looking at is birth registration, and then actually moving to the birth certificate stage is a secondary level. Yeah. Our real focus is if the child is registered, then that birth certificate that they need for whatever future requirements is easier to achieve. So registering the birth is one of the most important aspects. The certificate in your hand is something completely different at a whole other level that, yes, we would like them to have. However, the birth registration is the primary that makes them not be invisible and be counted within our society.
Yeah. So how do you simplify this message? When you're talking about different cultural groups, you're talking about different types of barriers, what seems to be the common core message that will resonate with all of them?
I believe that the common core message that we really need to get across is that the Vital Statistics Office is engaging in a lot of new ways to stay within the law, definitely, because this is something very important for fraud not to occur. However, that there are different types of identification that a mother or a father or whomever is coming to register the child can utilize. The fact that the BVS has instituted buildings which are next to the hospital and are separate. So the reality is that there is the availability the minute the child is born, the child is born within the hospital environment. But also, like Luwani mentioned, there are additional areas where we're looking at even possible in the future telephone registration, because remember, it is not the certificate process that we're looking at. We're looking at having these children registered so they are included and they are a part of the process. But one of the most important things that I think we have to get across today is that early registration makes it a lot easier for the family member. And we do know that the distance of traveling and the cost and the fear of being out there is something that you've mentioned, and maybe not having the proper documentation. But there are going to be assertive efforts towards this mobile registration within these specific affected areas that we mentioned, which is the north, the west, and the south of the country over the upcoming weeks, following social distancing measures. But it is absolutely important for our policemen, our officers, our Belize Vital Statistic officers to also realize that we need to be able to empathize, respect, show that concern, and realize the importance of our jobs and the importance of a child being registered. Many times we take our jobs lightly and do not realize the impact that we place within the environment. But this is one that we would like for all persons to take as core, as mandatory in terms of taking care of our children, which it may be very cliche to say, but they are our future. And if they are invisible and they are stateless, they do not have the level of support that they need to thrive within our countries. And I would ask that even within a community perspective, that we assist our neighbors, our friends, our fellow villagers, and our indigenous persons to facilitate these processes. So in giving, I know many times we want to provide physical things to people, but I would like for other organizations to join on this campaign and maybe help to sponsor a family being able to ensure that all of their children are registered, and that adults that they're aware of that aren't registered become registered. Because I do know that within the education system, principals are facilitating these children, but at the end of the day, we still need to get them to that point of having them registered within our community, and so they can gain the benefits of being a citizen of this country, which are many, by the way.
Absolutely, absolutely. So you have your launch tomorrow, and it's going to be a campaign that's going to that you're going to be speaking directly to those who tend to fall victim of not getting their children registered or delaying the registration of their children. So tell us a bit about the launch tomorrow.
The launch for us is very exciting because COVID has delayed it for quite a bit, but we will be on facebook.com/Chamberlain Consulting Live. The launch is a media launch due to social distancing, and it will be held at the Mexican Cultural Institute at 11 a.m. tomorrow, August 4th. And like I said, it will be live. And within this campaign, we will speak to the different target groups and the target populations that we are going to be coming. However, we are very interested in sensitizing the media, because the media, we are hoping that they will continue this message of the need that needs to occur. And we ask that other philanthropic organizations and other agencies out there who do a lot of philanthropy realize that this is one of the social goods that is most important to do. So we want to pull on organizations like Rotary, Red Cross, and all of these other organizations who look at the validity of taking care of human rights. And we're working very closely with the BVS for them to look at the way that these processes are facilitated for these persons who are often scared to go into a government office to get processes done in terms of improving the level of empathy, customer service, care, and guidance, and not the turnaround that many people feel that they experience from time to time. So we don't want this to be just a launch for tomorrow, but we are also going to be doing it, as Luwani mentioned, in the 3 core languages. And I hope that you air the 3 languages that the recordings that we gave to you. Quechua Mopan is Quechua Mayan, Mopan Mayan, and Spanish are the populations that we're targeting in these specific areas, which are the response to the bottleneck analysis. However, as Luwani mentioned, during this period of COVID-19, we're afraid to even visit hospitals. So we have to make sure that the registrations are not even falling more beyond this. So tomorrow, we'll be mentioning the villages that we'll be looking at going at specifically, all the efforts that we're doing, the concessions that the BVS is doing to stay legal, yes, but at the same time go out to help and assist that we bridge this gap that we're facing right now. And so today is really our plea on OIE, and I thank you all for having us, is to really have the Belizean population realize that we can help alcaldes and village leaders and town people. If you know of anyone who is not registered, encourage it, because statelessness is not a place that we want to have so many of our children exposed to, because of the ills of society that can be attached to that at the end of the day. So again, getting our people out there, keeping this on mind, and realizing how important it is despite all of the different challenges and noise and distractions that are happening in the world. UNICEF and UNHCR are focused and committed on this, and we really need to help push them along as nationals along with the BVS. Yeah.
Well, you know, I think clearly all of you have outlined why this is so important, and that even at 4%, it is 4% too much. Children deserve, first of all, a right to an identity, and that starts with being able to have their birth registered, which allows them to access all the other rights as well. So we do hope that your message is heard by the relevant authorities, by the people who perhaps have wavered on whether or not they should go out and register their babies right now, and for those who haven't considered it, that they will do so as well. Best of luck, and thank you for telling us all about it.
Thank you for having us.
All right. And so moving from that conversation, since we talked about children, it is time for another edition of Kids Time. Dr. Binox has been teaching us all kinds of fun stuff. Today, he's going to be teaching us a bit about geography, and specifically the 7 continents. So let's get moving into Kids Time.